Now, radio. Good afternoon, Santa Cruz and world. This is Dr. Duncan McCollum coming to you from McCollum Wellness Radio. And I thought that would be an appropriate beginning to the show because I have Dr. Troy Binfield with me. And this guy's a little bit of a wild man, and I'm so happy to have him on the show with me today. We're going to be talking about chiropractic and about health, about different things that can help you become healthier than you ever imagined. So Dr. Troy, welcome to the show.
Well, thanks for having me. It's a great weekend, and it's exciting to be here. It's a magical place. People of Santa Cruz know. I came up from Monterey today, so a little bit of a drive, but a pleasure to be here and just feeling the good vibes.
Yeah, and Dr. Troy and I have known each other since probably January or right at the end of December, and we've been working together since then, and we've had quite a ride. We've been having a blast. The office is so fun with you in it, Dr. Troy. Your energy's great. People love you working with them. And at any rate, Dr. Troy's a chiropractor. He's been in practice for how many years?
I graduated Life West in Hayward, California in December of 2014. So the years are adding up for sure. seven
or 8 years. That's great. Yeah. Man. That's good enough to know what to do, what you know when to hold them, when to fold them, and when to walk away or run. And that's one of the main things that we tell our patients in our office right off the bat is, look, if we think we can help you, we'll let you know. And if we don't think we can help you, we're going to let you know right away, because we don't want to waste your time or money or our time trying to fix something we don't think we can. But what we will do is try to get the best doctor for you if we don't think we're the right person. And perhaps it's a different type of doctor. At any rate, so Doc, things have been going so fast in the last few months, and our office is just helping so many people, and we're having so much fun. But I have not really heard your story on, all of us come to chiropractic by our own story. And I've been dying to hear your story. And I thought, why not just wait and get it organically on air today? You can tell the peoples of Santa Cruz why you're here, what you're trying to do to help people, and why you're in practice. What motivated you?
Yeah, to quote from the Blues Brothers, I'm on a mission from God.
Love it.
It seems like we make our own plans, and then, life takes over. And, sometimes we're reacting. Of course, I want to be proactive, but, they say the gurus, the masters, the chiropractors that my mentors have mentored me, been in the business, of helping people and doing miracles, the business of miracles for 30, 40 years. They told me chiropractic chose me. And so, listening to my story, I can't deny, that seems to be the case, right? Like I had other plans, Doc. I wanted to be a musician, I rock and roll, and, we're never going to stop rocking. But I went to school for music originally.
Where'd you go?
I was blessed when I was in high school and junior high school. I had a great music teacher. He was studied at Juilliard. And so I went to school in New York in high school. We had a great competitive
Oh my God,
band.
you went New York? That's why I have so much trouble working with you. I'm just kidding.
You Cali guys hate on us New Yorkers, but we're here to help. So look out. Just speed up a little, okay? So I started undergrad in New York for School of Music. I was on scholarships, and I learned a lot. So I had a great musical education. Unfortunately, opportunity in music is somewhat difficult to carve. not impossible, but like any industry, you really got to pay your dues. So,
Keep going.
back to chiropractic choosing me. I was a weekend warrior. I was always an avid athlete. I played roller hockey when I was young, and then I got into mountain biking. A lot of my friends would grab me on the weekends and basically force me to go with them up to the mountains, the ski mountains. And so became the world of athletics is the world of injuries. A lot of our patients, a lot of you people out there listening are suffering with injuries. There's chronic injuries that seem to never go away. And, we're great helping with those. I get comments like, man, I've been to other chiropractors for years and, you fixed me in one shot. What did you do? And so we don't promise miracles. We just expect them. And, and now today's age, I can't help but think, I'm segueing from my story into the TRT machine, because this is the end of my story where I'm at right in this moment where the injuries still linger. I was a snowboarder, mountain biker, so a lot of serious chronic injuries. Mainly it was a mountain bike injury that did me in. My handlebars snapped. We would go to Hunter Mountain. New Yorkers know it's the big ski mountain on the East Coast. The Catskill Mountains, we could go further up to where they had the Lake Placid Olympics, is the Adirondack Mountains. But 3 hours away is pretty good drive. It's doable for some good skiing. And we would go, hike the back trails, do the crazy stuff. And mountain biking on the back trails, the ski trails, pretty insane. And I had aluminum handlebars, no front shock absorber. So aluminum apparently fatigues. The engineers out there know this, and it has a lifetime. So you mountain bikers who don't know, change your handlebars. If you have aluminum handlebars, change them. Mine snapped on me, sending me into a big rock, which pretty much dislocated my pelvis and sent my back into a scoliosis.
Wow.
So I was getting worse. I was getting sick. I was having vomiting attacks.
What year was this?
This was 25 years ago.
Wow.
I was about 25. And so I was super strong. And I thought I healed pretty good from my pelvis injury. My entire pelvis was black and blue. I had a black and blue the size of a basketball. And I didn't go to any doctors. I didn't go to the hospital. I don't play that. Homie, don't play that. I'm one of those tough guys. So I played it tough. And I was going to Miami the next day. Me and my buddy had the flights booked. We were going on a scuba trip. And I was like, well, I could barely walk. I could limp. Maybe I could get on the boat. You just push me off in the water and I'll sink. And that's what happened. So it was a great trip, but I healed crooked.
Yeah.
And so I can blame that injury, although they say it was an idiopathic scoliosis.
So idiopathic means it is something that happened because of a medical.
They don't know the cause.
Yeah.
It's idiopathic. We don't know. What caused my cancer, doc? Well, we don't know.
Yeah.
Well, hey, I got liver cancer. I was never a drinker. What caused it? We don't know. So most pathology is supposedly idiopathic. But when you come to real doctors, they give you the truth. And we find that there's basically, if you boil it down, there's only two causes of pathology. And that's deficiency, if I could speak English, and toxicity. So those are the two basic things. We're not getting nutrients in our food these days. If you're eating organic, better, but they say even that can be deficient in minerals. So what do we have left? We turn towards supplementation, which is a whole nother can of worms. And I'm not totally against that. If you have a horrible diet, you probably should be looking into this. And so, I'm into diet, health support, being an athlete, and, that's where chiropractic is. It's a natural, holistic, wellness methodology and philosophy that made sense to me. The natural doctors are the ones that found the truth. The medical doctors were not helping me, doc.
Yeah.
I was sick my whole life as a kid.
Yeah. Well, I was too. These people are very well aware of my story because I've told it so many times. So that's amazing. And we all come to this our own way. We finally find our truth. Now, every year we have to do 24 hours of relicensing. And I always wait till the end of my birthday month, which was February. So I just crammed in 24 hours of relicensing last month. But what was very interesting is one of the statistics that hasn't changed ever since I've been in practice, which is over 30 years, is only 10% of the population go to chiropractors. 15% of the people do yoga and 15% of the people do meditation. However, and that's great.
Yeah, it's good for them, right? It's good for those 15%.
Yeah. However, when you really take a look at how the nervous system works, the nervous system is the #1 controlling system of our body. Every single perceptive that we take from the environment, whether it's from our eyes, our skin, touch, feel, hearing, taste, gets to our brain via a hardwired nerve. And in our brain, it turns to a chemical called a hormone. Gets into our blood, it goes into every cell and organ in our body. So, if you take a look at what's going on in the world medically right now, and in the United States, we're rated 47th in the world for health. We take over 50% of every drug made in the world, and we're only 4% of the population. So if it ain't broke, don't fix it. There was back in I was talking to a patient, you might have heard the other day, I was talking to a patient about the Sherman Antitrust Act and Dr. Chester Wilkes and the lawsuit with chiropractic that went on for 20 years. A lot of the people that listen to this show are my age, young people in their 40s, 50s, 60s, and 70s plus.
Boomers.
They might remember in their 60s and 70s that chiropractic was really looked down upon by the medical profession. In fact, the medical doctor could not refer to a chiropractor. Well, finally, the word got out. Somebody, and we don't know who it is, an inside person to the AMA, dumped a whole stack of articles on the AMA letterhead on the doorstep of Dr. Chester Wilkes, a chiropractor. And it all said basically that the AMA's purpose was first to contain and then eliminate chiropractic from the United States. So this was a 20-year lawsuit with 4 chiropractors we don't get funding, fighting. It was David and Goliath, right? David were the 4 chiropractors and Goliath is the AMA fighting us in court for 20 years. And finally, it got all the way up to the US Supreme Court, and the AMA was found guilty of first trying to contain and then eliminate chiropractors from the United States. A pretty big blow. So they had to apologize. So that morning on the New York Times, if you opened the paper and went to the obituary section, there was a small stamp size article by the AMA that said, "We're sorry that we tried to eliminate chiropractic." And that was it. And it's taken years for the recognition of chiropractic to come back. Now, back in the 20s and 30s, even when Rockefeller was, really pushing sulfa drugs and trying to, not only did he eliminate all the small people regarding the oil companies, but he knocked out 180 homeopathic colleges in the United States to basically where there were next to none. And allopathic medicine took hold, and that was symptom-related drug medicine. And it has boomed to a point where the United States takes, I've heard 70% of every drug made in the world, the United States takes. 4% of the population of the world take 70% of all the drugs made in the world, and we're still rated 47th in the world for health. So if you want a good stock, that's what you should be, investing in is drugs, because they cover up symptoms. Now, as you all know out there, I busted my appendix in November. I burst my appendix. I was in the hospital for 5 days. I would have died if it wasn't for emergency medicine. And thank God I live in the United States, because they have the best emergency medicine in the world. Now, covering up the symptoms might be another question. We're going to come up to our first break here, and we'll be back in just a couple minutes. So David, take it away. So Dave, we were trying to get to our break there. Are you ready? Okay, he's ready.
McCollum here, and I have Pastor Mark with me. He came in and experienced the stem cell machine, the TRT machine, and he wanted to just go ahead and tell you a little bit of his experience.
Yeah, I injured my knee years ago from sports and being dumb. And after the first stem cell treatment, after the very first one, I could do a full knee squat. And doctors told me that we want to replace your knee. And my knee would just ache just from sitting. And you probably experienced that if you have knee problems. But now, no ache. I can walk without pain. And when I sit, I had no pain. And I just love it. I'd recommend it to anybody. It's terrific.
When we looked at your x-rays, your discs in your knees look pretty good too.
Yeah, they're improving so much. I just love it. I can't wait for my treatment every week. Highly recommend it to anyone.
So you'd recommend they do the $49 special to see if it will work for them?
Oh, absolutely. That's what drew me in was the $49 special. I thought I got $50 to spend to just see, and it certainly has paid off.
Call 831-459-9990. Thanks.
And now back to McCollum Wellness Radio.
Hello, everybody. I'm back. It's Dr. Duncan McCollum, McCollum Wellness Radio with Dr. Troy Benfield with me today. And we're, we're kind of, the reason I'm playing the Magical Mystery Tour is because, this life is so fleeting. It goes so fast, and we have a chance to really enjoy it by being healthy or not enjoy it by being unhealthy. And that's not just, regarding your body. That could be your mind. It can be the people you hang out with and all that. So I really encourage us, and the name of the show, if you're following us on Facebook, Duncan McCollum Facebook, is Today's the Best Day Ever to Have a New Beginning. And you can't have a new beginning. You can decide, I'm going to do something different today than I've ever done in my life. And that could be just with the decisions you make, because what you think about, you talk about. What you talk about, you bring about. So what have you been telling yourself in these days about your health, about your life, about your friends, about your future? We're coming out of the second dark ages. I just named it. The last 2 years, it's been almost like the dark ages, where so much has gone on, so much fear has been mongered, and so many people have become less healthy because of the what's called the sympathetic fight or flight nervous system has been turned on in full tilt for 2 years. And when you can't see a tiger, it's an invisible tiger. You can't see, taste, touch, feel, hear, even sense. You don't know if it's there or not. All you can be is on red alert. This creates heat in your body, and that heat destroys joints, it destroys organs, it destroys nerve synapses. It actually weakens your immune system, it weakens your digestive system, and it turns down cognitive brain function. And, we're coming out of the dark ages. Right now is a new beginning. You have a choice to make a difference, and I hope that you take advantage of it. Dr. Troy, you know Pastor Mark, who just talked on the radio. He came in, had such an amazing first experience with the stem cell machine. And now you've had some experience with the stem cell machine. We did it on, you came in, you didn't know it. Dr. Troy's what we call a straight chiropractor. He doesn't do what, there's straights and mixers. And, that's kind of old news these days. But regardless, he comes in and he sees my stem cell machine, goes, "You're a mixer." But then he tried it. So what did you experience from that?
Right. So for the novices out there, what does that mean? It means that, chiropractic is the meat, the rest of the therapies are the potatoes. I mean, not that they can't benefit you, but I live my life by the Pareto principle, the Italian mathematician who basically, you can lump anything into 20% of your efforts are going to bring 80% of your results, 80% bring 20% of your results. So you got to go with what works. We're all pressed for time. Everybody's sick. Basically, I'm excited because we see miracles every day. We can't help everyone. There's very few people that we do turn away. However, we do help a lot of people. And, so mixers, they're using technology. They're using ultrasound. They're using lasers. They're using, additional therapies, anything that's not just a straightforward chiropractic adjustment. And the old school chiropractic philosophers, they didn't want to confuse the patients who think, hey, it's the other stuff that's really helping me. Whereas, that the old schoolers, they feel it's the chiropractic adjustment is the meat. And that's doing the work, giving you the 80% of your results. But it depends, because sometimes people have a muscular issue. If you tear a muscle, I recently, I was a snowboarder, I got a lot of old injuries, and I have had very little therapy, a little bit of physical therapy, but adjunct therapies, physiotherapy is the category we put the TRT stem cell machine into. And so, quite honestly, I've been suffering for the last 3 years or so with a partially torn quadricep muscle. And quite honestly, while chiropractic kind of does globally help all your, abnormalities, it's not necessarily gonna, help you regrow back a torn muscle. So I was searching for some additional therapy, even though I didn't want to be a mixer. I said, hey man, if there's something out there that's non-invasive that I can use to avoid surgery, then that's what I need to do. And so I would, run into a lot of different chiropractors in the different offices I worked in, and they would say, hey, you got to come to my office. We got this therapy, that therapy. And I do vacation relief for a lot of chiropractors. So last month I was in Santa Rosa covering for a chiropractor who he hurt his ribs. He almost broke some of his ribs, and he had in there a shock wave machine. And now I see this is becoming very popular modality for a lot of chiropractors. And I would call it the mini TRT. It's like a baby TRT. It's kind of the same technology, just as like ultrasound is kind of using the same therapeutic ultrasound is using the same kind of a sound wave to stimulate healing. Now, when they dial in the right frequencies and they got the technology, what's happening is stem cell proliferation. And all I can say, in short, I want the doc, I'm going to give him back the mic and let him talk about it, because it's just amazing. And, as a patient, I'm sneaking in at night and in the morning when the doc's not around, and I'm doing the TRT on myself. And so I've had maybe 3 sessions, and we're talking about 5-minute sessions, doing this on my quadricep. And I gotta say, it's, I don't know, 70, let's go 80% Pareto principle better. So, I've done it since over about a month or 2. So it hasn't been intense. It's just been sparse. And they say that for, up to 10 weeks, you still grow back and the stem cells proliferate and you generate new tissue. This is a game changer, people. I don't know if you get this. I mean, I'm trying to shout it out because, you got that maybe bone on bone in the knee and the cartilage is starting to wear away. Well, what are you going to do? Well, maybe you could regrow some new cartilage. Wouldn't that be great? So now we go to Mexico, we go to Utah, we get stem cells injected. They got placental blood and marrow and invasive procedures. I personally do not break my skin for anything. So I don't do injections, I don't do needles, I don't do surgery if I could avoid it, and I try to avoid pharmaceuticals as well. It's not always easy, but I find this is a good longevity philosophy. And so, yeah, I mean, the TRT, I can't say enough. Like, now I can start to exercise again. With a torn quad, I could barely work. I was worried that I wasn't going to be able to keep working. And so it's a game changer. I'm back in the game. I'm not worried physically about losing my job and the consequences thereof, the quality thereof. Now I'm confident I can continue to work, and we work hard. We're working hard for you people. So come on in, check out the TRT. I mean, $50 is an amazing trial. You heard Dr. Mark on the commercial saying, not Dr. Mark, Pastor Mark, saying he tried it for $50. Well, it's like $300 for 5 minutes or something. Like, it can be very expensive to run these machines. This is not, a very, cheap therapy. It's generally not covered by insurance because there's very few people out in the world that do this. How many machines are there even in the States, Doc?
Well, when I got my machine back in 2019, there were less than 200. And I had one of the first ones in California. In Northern California. There was one up at UCSF, but not used for what we do. They were doing surgery or studies on hearts up there. So I got mine. There's now less than 400. There's about 600 in the world. The number of my machine is the 403. So you can come in and try the 403. It sounds like a train. And if it works, there's nothing better that you could imagine. Hey, you did your shoulder too, didn't you?
Did the shoulder. And the reason I wasn't bragging about the shoulder is because, well, it did pretty much fix the shoulder in one session. But I have chronic, right? So, people ask me, hey, why do I have back pain? Why do I have neck pain? We call it subluxation, a situation of less light. And the three causes are traumas, thoughts, and toxicity. So traumas, right? Obvious. You get a big shoulder trauma, that's obvious. What's not so obvious is the repetitive micro trauma, or that you sit and type all day, and that's what's killing your neck and your shoulder. Sitting, they say, is the new smoking. So I'm adjusting people, 50, 100 people a day, and so I'm sure a lot of you out there can relate. You're hurting, and you still have to go back to work and re-injure yourself every day. These tiny little traumas. So for me, it fixed my shoulder basically in one session. And then what did I do? I went right back to work the next day on our 300-pound patient, and put it right out of the socket again. But it is feeling great. I need a couple more sessions, I think. Actually, if I could rest it a little, I think it would be there. So, I mean, it is a miraculous machine, and I'm not a proponent of the machines, right? I'm the guy who's saying, let's get the chiropractic going, and, the machines, as a side, that's the gravy, right? But sometimes you need the gravy. Sometimes it's all about the gravy,
Yeah, I think the way I explain it a lot to people is usually, you can have an immediate trauma, like a sports injury, a slip or fall, a car accident, but you really touched it. A lot of this stuff is micro traumas over time, sometimes years and years and years. If you think about, if you've ever had a toothache that came from a cavity, that cavity didn't happen yesterday and you had a toothache today. That cavity's been growing over several years. When it finally gets to the nerve, you want that tooth handled as quickly as you can. We get a lot of people coming in wanting pain relief. And so oftentimes 1 or 2 adjustments can help the spine feel better. Sometimes one is miraculous, but just pain relief is kind of like taking a medication to cover up the pain. That's not our philosophy. Our philosophy is for your body to work as good as possible. And not everybody wants that. And when you come into the office, we do an exam consultation. If x-rays are needed, we'll take x-rays and clear that with you first. But one of the things that we tell you is, look, I'm going to show you what we found. And you have 3 choices. One is to do nothing, which may or may not be a great idea. The other would be, hey, I just want to patch it up right now. I'm leaving town. I've got something else I've got to take care of. I've got other financial obligations. And the third is, God, I want to live the rest of my life as healthy as I can. What can I do to get this thing healthy? So whatever your decision is, we're gonna tell you what we think we can do to help you. Sometimes we can, sometimes we can't. Most of the time we believe we can help you, we'll let you know. But I just kind of want to run through chiropractic this week because I was kind of really astounded that we're still only treating 10% of the people. So that comes from a lack of understanding what chiropractic does. So again, the nerves that come out of your brain go down the center part of your spine. There's only 31 spinal nerves, 31 on one side, 31 on the other side. They split and split and split until they innervate or go to 75 trillion cells in your body. So that's amazing to think what a network of nerves, peripheral, meaning outside of your spine, nerves that you have going to all of those cells and organs, and their job at communicating to and from the brain. We all have conflicts in our life. We all have people that we may not get along with, family members we may not get along with, family members that are sick or having trouble. And that's hard to sometimes work in the environment. We might live in, we don't, but we might live in the snow where you have to shovel your snow to get out of your house in the morning. Well, just imagine what your body's going through if it's fighting with itself every single day just to get up. There's inflammation in your body, there's toxins in your body. You haven't eaten the right food. You don't have your blood sugar, you got a blood sugar problem. 60% of the people in the United States are diabetic or pre-diabetic. There's 30 million people diagnosed with thyroid condition, So before you even get out of bed in the morning, half of your energy is going to try to combat the argument within your body. You are not going to have a good life. So, eventually it's going to catch up with you. You're going to get comorbidities, which means other things in your body making you sick. You might be confronted with some kind of immediate threat. And we went through that for 2 years, an immediate threat going, if you don't take care of yourself, this is gonna, be your demise. Now, the people that had a problem with that mostly are the people that had comorbidities. Co means also morbidities, like diabetes, already had liver conditions, heart conditions. They already had colitis or digestive dysfunction, leaky gut syndrome, all those things. So our job, and because I do a lot of nutrition in the office, as you've all heard me say, and Dr. Troy said, there's basically 3 things. There's a physical condition, chemical condition, and a mental condition. Those are the only 3 stressors that we're come across in our life. Then, if you want to live a good life, then you've got to get yourself healthy. So many people miss the chiropractic part of it.
The big picture.
The big picture, which is the way your body works. The first thing, when you were conceived, an egg and sperm came together. And that day there was 1 cell. In 8 days, there were 8 cells that all looked exactly the same. By day 16, you could differentiate on an electron microscope or light microscope. You would see a streak forming in that clump of cells, and it's called the primordial streak. And it was the beginning of the nervous system, the first thing you could ever see in the development of a human being or any life form on this planet is a communication system. From that nervous system and that communication system came branches like a tree that went off. And at the end of those branches forms little buds that become hearts, lungs, kidneys, fingers, toes, appendixes. I don't have one anymore. And all those things. But believe me, if that primordial streak wasn't there and you didn't have a brain connection from that brain to those organs, they would never function correctly. So why do we think by having interference in that nervous system right now would allow us to be healthy, and that a medication covering up a symptom is going to get us there? So that's chiropractic. All we do is we look for sources of interference in the body. We remove those sources of interference so the body can do what it's supposed to do, which is communicate and heal itself. So rather waking up with all these arguments going on in your body because of chemical interference, because of nerve interference, because of the mental anguish you are confronted with or put your own self through, then what would happen if we cleaned that up? So that's what we do in our office. And I encourage you to just call us. Come on in. You can do, I'd say come in for the $49 TRT special. Because, yeah, during that time, we do a consultation, evaluation, we take some x-rays. Whether the TRT is appropriate or not, it's a great way to find out what you can do to be healthy. So Doc, well, you know what? We're going to take another commercial break and we'll be right back. We'll see you in a sec.
Hey, this is Dr. Duncan McCollum, and I have this amazing patient, Lauren, here, and she had a few things to say.
Hi, I'm Lauren Spencer, a local realtor, and I've been seeing Duncan for years now. I had a biking accident, and he's been adjusting me since then, and it's been amazing. But lately, I've had trouble with my feet, and I'm an avid walker, avid biker, avid golfer, and my feet were aching all the time. And I tried Duncan's TRT machine, which is an amazing stem cell machine that rejuvenates the cells. And my feet, I've had like 3 or 4 sessions with the machine, and my feet are like new, no aches, no pains. It's a miracle. So I really highly recommend Duncan and his chiropractic services, but also that TRT machine. You got to try it.
Wow, thanks, Lauren. That was awesome. So we still have the $49 special. Come on in and see if it works for you. Thank you.
Now back to McCollum Wellness Radio.
Okay, we're back. And that's Lauren Spencer. What an amazing lady. I should ask her to re-record that testimonial because some of you know her. She went off a 93-foot cliff riding a bike and just luckily she's a very light person. She floated down to the bottom, but broke several ribs. Her jaw in 6 or 7, 8, 9 places was airlifted out, and she's amazing that she's recovered so well. And I just feel so privileged to be able to be part of her healing or her recovery, and also, you know, just to keep her as healthy as we can. And she gets the stem cell treatment. She had one last week just to keep her maintenance up now, and she gets adjusted on a regular basis. So I highly recommend that you make a new decision and decide to do something different. You know, the majority of the people in this country have chronic disease. In fact, there was a study that came out of Michigan University that said 80 million Americans have multiple chronic diseases. So multiple means 3 or more. 80 million is about a third to a fourth of our population in the country. So who benefits from us having all of those comorbidities? Now, remember, we take 50% of all the drugs for 47th World Health, and we're only 4% of the population. So what I want to do for a few minutes here is, Doc, what have you noticed when people come in with the very upper part of their neck? We call it the atlas or occiput, or C2, the second cervical vertebra. What are some symptoms that you might experience that people might talk about and get over when we just take care of the upper part of the neck?
Yeah, so there's some chiropractors that do only the first 3 vertebrae. If that, they do C1 all the time. And
That's the top vertebra in the neck.
we all get these classes as a core, no matter what chiropractic school we go to. Upper cervical, typically it's the toggle technique. And so the chiropractor can basically fix anything, you know, in air quotes, right? Loosely fix anything by adjusting C1. Why can they have such great results? You come in with knee pain and, you know, you're looking for a knee adjustment perhaps. And then the chiropractor says, lay down and he adjusts your neck and the knee pain goes away. How is that even possible? Right? So the whole time you're talking, and I'm just, it's horrible like that so many people are so sick and they don't know the magic of chiropractic. It's so simple and affordable and easy, right? In 2 minutes, they can come and get adjusted and feel better. And why do we get such great results? Because we're working on the master system. The nervous system controls all the other systems. The endocrine system is controlled by the nervous system. At C1, we're working on the pineal gland. The pineal gland affects all the other glands, right? So if your hormones are imbalanced, this could be greatly affected. And what you mentioned earlier was the 2 modes of the autonomic nervous system. There's the fight or flight mode, and that's where most people are trapped. They're coming in, their breathing is shallow. I tell them breathe deep and slow. That's how you can really take back control immediately of the autonomics. Be aware of the autonomics. Be aware of the stress. Stress is killing us. We talk about the 3 T's to cause subluxation: thoughts, traumas, and toxins. So thoughts, the stress. It's the stress. I'm in there repeating myself all day. It's the stress. Breathe and relax, right? And then we can get a good adjustment. So what are we doing? Are we manipulating joints? Are we joint manipulators? No. We're brain manipulators. We want to turn off the fight or flight mechanism in your brain and get you to calm down, get the heart rate to, you know, maybe perhaps slow or regulate the blood pressure, usually to drop, but again, to regulate. Chiropractic patients find they don't need medications to regulate their, you know, endocrine system, their heart medications. A lot of patients find they're no longer needed. And that's fantastic because, you know, the pharmaceutical industry and the doctors out there trying to help us are doing their best. But, you know, I don't believe there's any pharmaceuticals that have 0 side effects.
That's right. Well, they're just called effects. They're not even, they love to call them side effects, but they're effects. They just affect your body certain ways. And, you know, I was doing a nutrition, one of my re-education. Now I study with Dr. Dan Papa, who's probably the foremost leading cellular healing doctor on the planet. And I talk with him weekly, sometimes several times a week regarding individual patients. But in this class, the lady that was teaching the nutrition, she knew a lot, but I got to tell you, some of the information out there is so old that it's scary that they're still going on some of the recommendations that they make. Because since the breakthroughs with, for instance, Dr. Yoshinori Asumi in 2016, the guy who won the Nobel Prize for Physiology and Medicine, and his understanding of the term called autophagy, was where the body breaks down bad cells. I mean, it's a whole new ballgame. And if people aren't up on that, it's an old science. And even now, that's old science. I mean, you got to stay up on the top end of it. But she was talking about some of the medications that are prescribed out there, like, you know, a cholesterol medication for one. And, you know, you got to do your own research on this. But back in the day, you know, 250 was considered a normal cholesterol level. And then they decided it was 225 because they could sell Lipitor and various other
I'm
things.
laughing because I know where this story's going.
Yeah, and they could go, well, everybody's too high. So if we lower that level, then we can sell more people Lipitor. Well, now it's 199. So how many more people go on Lipitor? And they want to get it down to 150. But the point is that you need those healthy, you know, maybe there are bad oils in your body, but you need healthy oils because your brain's made out of fat. Whoever called you a fathead was right, but you want to have the right fat in there. So, but what they are, if you look up the side effects of some of these blood or these cholesterol lowering medications, you're going to find out that they stop your body from being able to use vitamin E and coenzyme Q10. And actually, what they do is they end up causing heart disease. So the very medication they're giving you to handle heart disease is causing heart disease.
Perfect.
And they're also causing you to shut down on the essential, meaning you can't, your body doesn't make them, you got to absorb them, essential fatty acids, so that every enzyme in your body, every chemical reaction in your body, the brain needs these essential fatty acids, the cell walls need these essential fatty acids, the mitochondria needs it. So we're basically covering up a symptom which they make, saying that 225 is too high for a cholesterol. And a lot of times they don't tell you if it's good cholesterol, bad cholesterol. Now, don't go out and stop taking this stuff. You know, you've been put on it for a reason. You need to do your research and then go talk to your doctor. If you want to come in and talk to us, we can talk to you and show you what to ask them. But, you know, that's just an example. They talked about Vioxx. Vioxx was the miracle painkiller back in the 80s and 90s when I was getting out of chiropractic school, until it killed some millions of people. And then there was a class action lawsuit to take it off, get off the market. And, you know, the drug companies have this philosophy. If it costs me $5 billion in lawsuits, but we make 35 billion, it's a risk worth taking. Right, wrong, or indifferent, it's really unfortunate that they are willing to risk human life for a profit. And now there's great doctors out there, medical doctors who are out there saving lives. My life was saved. But, you know, it's time to make a change. It's time for you to,
It is.
you know, make
It's overdue.
Yeah, it's right.
And we change lives.
Yeah.
You know, that's what it's about, right? In my example, I was talking about worrying about losing the life that I made. I mean, I was a truck driver in New York and I got injured. Chiropractic saved my life. If my friend's uncle, one of my best friend's uncle, wasn't a chiropractor, I'd probably be dead right now. The scoliosis was getting worse and I was dysfunctional. So, I mean, I can't emphasize that enough. That's why I love the chiropractic. It really saved my life. And it's so frustrating that people don't understand the big picture. I feel like we can't talk about it enough. That's why only 10% are going, because if people knew, I mean, yeah, okay, maybe they think it can help with their back pain. They don't realize it can help with their irregular menstruation. They don't realize it can help with the ADD, the ADHD. A million other acronyms. It's headaches. Okay. So when I'm doing an exam, the first things I'm looking for, the top 3 things are insomnia. If you ain't sleeping, you ain't healing. The body's only healing when you're sleeping, when you're at rest. If you can go into the parasympathetic dominant state, now the body begins to heal. When you're caught in those sympathetics, you're not healing. So headaches, anxiety, and insomnia are pretty much my top 3. But like anxiety, you know, I'm frustrated because we're not really legally supposed to advertise that we treat and cure conditions. And yet most of our patients find that a lot of their conditions just disappear.
Well,
So
I'm gonna jump in because you know, what we do, we don't treat or cure conditions.
Exactly.
We free up the body's ability to heal itself. And that
Yes.
is the biggest misnomer or mistake people make. And, you know, chiropractic is just helping your body do what it's supposed to be. Your body's not supposed to have headaches. It's not supposed to have bloating. It's not
Well,
supposed to have.
people think that's normal.
Yeah.
I say headaches, and no, and they didn't circle it on the form.
Oh, yeah.
And I'm like, well, what was that hemming and hawing about? Like, so you get some headaches sometimes. Oh, yeah, well, not that often. Well, what's that? Oh, once a week.
Yeah.
So once a week, a headache is normal. It's normal to get a migraine. It's
Check
normal.
this out. So you ask them
Yeah.
once a week, how many years have you had that? Oh,
Right.
probably 15 years. Okay.
Right.
Once a week, that's 52 headaches a year,
Oh my
times 10 years is 500 headaches in 10 years. Does that seem normal to you? And if you're taking aspirin or other kind of medication for that, probably you're going to end up with stomach problems and bleeding in your stomach, which is going to cause your small intestine to not work right, which is going to leak down to your large intestine, causing leaky gut syndrome, which is going to allow all these bad parasites and bacteria and undigested food particles get in your bloodstream.
Big
That's,
time.
that's going to get to
We
your
need to do
organs.
another show just on this. Can we do a whole
Yeah, we
hour
will.
just on
I
that?
think
Because people underestimate. They think, you know, the pharma, the prescription is, you know, more serious, but over
Yeah.
the counter, hey, that couldn't hurt me.
All right. And you know what? One thing that this lady was talking about, who did my nutrition class, she had a lot of really good things, even though some of her stuff was antiquated, was talking about proton pump inhibitors, which is for gastritis
Don't
and
get me started.
bloating. Now, most of those were actually prescription drugs until the patent ran out of them.
Okay.
And now you can get them over the
Right
counter,
on.
but
Oh,
they're
wow.
actually shutting down your body's ability to heal, because it's blocking your body's ability to make hydrochloric acid, and it's basically that hydrochloric acid is your first line of defense on anything you eat that goes into your stomach.
Yes.
That
Yes.
hydrochloric acid is pH 2. It will eat a hole in
Yes.
this table that we're sitting
That's
at
right.
now. That's in your stomach, and it's a mucus lining that protects your stomach from that. But when you take those proton pump inhibitors, you know, we even know right now that Tums is setting people up for cancer, right? And Alzheimer's disease.
I haven't seen
Because
this
of the
research,
aluminum.
but I believe it. Yeah,
Yeah.
no, exactly. And the problem is most people do have low stomach acid. They
Yeah.
need more. It's the opposite. They don't need
Exactly.
a proton purple pill.
Exactly. And so, this has been great. We'll do this again, Doc, real soon. I think the people would love to hear more of because we bounce off each other real well. But my point is, I don't even know what my point was on that, other than, that stuff used to be prescription, and now you can buy it over the counter, and it's actually it's actually now been pointing towards cancer, stomach cancer, colon cancer, and these other type of things, because when you stop HCl, hydrochloric acids, from killing the bad bacteria, viruses, parasites, amoebas, and other things that get into our body, and it also doesn't allow you to completely break down the protein that you're eating, which is one of the primary things it's supposed to do. You get that stuff into your small intestine, undigested now, and then to your large intestine, very large particles. This stuff causes inflammation. The inflammation blows open the gut lining, causes something called leaky gut. Bad particles and large bacteria get into your bloodstream, float around to these 75 trillion cells, plug up your liver and your kidneys' ability to detoxify your body, and you're in a mess.
Yeah, it's super common.
Yeah.
And it's stress, right? Stress lowers the stomach acid.
Exactly.
I mean, stress we could blame for most. I mean, that's what we can change anyway. So that's what I focus on.
And remember the three stressors: physical, chemical, and mental.
And so how do we change the chemical? If their air is full of toxins, you move to the country, right? Move to someplace with clean air. We live by the coast, so it's pretty good. We're getting pretty good air.
Next time we come on the air, we should play our own song in and out. I'll play bass, you play guitar. What do you say?
All right. If you want, I'll bring the Mike Mattingly. He's got his own full set of songs. I think would fit right in. Perfect for us. We can have our own band.
Yeah, we'll do our
We're
own
getting
thing.
a band for the show, all right? We're upgrading.
You play what? Bass?
I'll play
drums?
anything you hand me. Don't hand me a harmonica.
All right. Well, this has been really fun. We've got a couple minutes left. This is Dr. Duncan McCollum Family Chiropractic in Capitola. Come on in and do the $49 special. for the TRT stem cell machine. I mean, hell, just pay $49. You can come in and meet Dr. Troy. What the heck?
Woo, woo,
You're
we
gonna
don't
want to
party.
meet him after this show, no doubt.
Not enough fun.
And or call and come in and just say, hey, I want to come in for a complimentary consultation to find out whether they can help my condition. You don't have to do the stem cell machine. You can sit down and talk to us about your health conditions.
Right, free consultations.
Yeah, free consultation, and then, you know, just say that you called or, you know, you heard the show, that you want to come in, we'll do that. And if we think it's worth moving forward, we will discuss any fees with you before we move forward. And if we don't think we can help you, we'll let you know that as well.
And I want to mention the True Cellular Detox.
Oh,
You
yeah.
mentioned Dan Pomp. You started going down, and I think I, you know, sidetracked you down back to subluxation because, you know, I'm so pro chiropractic. But, you know, even as a straight chiropractor, I got to be a mixer because it's a holistic philosophy. It's the support, you know, it's the whole system. And, you know, so if you're toxic, your diet is horrible, most people, if I took a poll, I could ask you, hey, what's wrong with your diet? Most people are going to have an answer ready. They know they eat too much fast food, they eat too much junk food, whatever it is. I should eat more of this. I should take a multivitamin. You know what you need to do. But if you don't know, you know, you're in trouble. Okay. So once you figure it out, you're kind of getting on the right track. We can help. We've got a great program going now.
It's a 3-month program that we're doing right now, and you've heard me talk about it. And you can start anytime. The first month is a preparation phase where we just get your body able to detox. One of the big problems people do is they go get something off the shelf and try to detoxify, but their guts are so blown open that they're just stirring up the mud in the pond and making themselves sick. Then we're going to start to get the organs below the neck, the detox, heavy metals, chemicals, finally the brain. But you know what? Give us a call, McCollum Family Chiropractic. We're located in 2 locations, apparently. One is in New York City, if you're going to come see Dr. Troy. And if you're going to see me, it's in Capitola. I'm just kidding you. We're in Capitola, Brown Ranch Shopping Center. We have a lot of fun in our practice. Our staff is amazing. You'll meet Bea when you come in, incredible young lady. Just started working with us. She's excited about helping people. Amazing story herself. Mariah is also at the front desk. She's fantastic, and we really love working with her. She's so calm. I've never seen her upset a day in our lives, and we sure try, but she just stays calm and holds the fort down. And then there's Arlene that's going to help you with any financial issues you might have on getting healthy. And then Natalie runs the show. Watch out. She's amazing. And it's been a great show. Thank you guys so much. We're going out with Magical Mystery Tour. Come tour our magical office. We'll talk to y'all soon.
KSCO 8 to 10 News, Santa Cruz. KOMR 1540 AM, La Selva West.
What do you do?